In today's world, there's an app for your mobile devices for just about anything. And an app for your medical records is reaching thousands of patients across the valley and beyond. We sat down with Senior Vice President and Chief Information Officer of Community Medical Centers with more details on the MyChart medical app.
So MyChart is essentially a portal for the patient to have access to their health information and do that from a web browser on their computer or their mobile phone. And it is secure, and the patient is given exclusive access to that patient data. And the patient is able to grant family members access to their information who are involved with the care of them, or for a parent to have access to their child's information. Another benefit is when you go to a healthcare provider who does not have immediate access to your medical information. Through MyChart on your mobile phone, you can actually grant that provider access to see your chart for a limited period of time and in a secure fashion. And it also allows you now to see your encounter information, visits you've had, lab work you've had at other providers outside of our healthcare system, and that's all available in your individual MyChart record. It is easy as using email. There is a username and password similar to an email account, and it can operate like an app on your phone. Or it's as easy as going to your favorite web browser and typing in the MyChart address and logging in and getting your information. Many of the provider offices like to have an additional means for the patient to have access to their information. And it also provides a way to mitigate having playing phone tag and communicating with their patients and answering their patients' questions. We've already started pilots of e-visits, so for certain limited conditions, you can actually go into MyChart and fill out a questionnaire about your current symptoms, and the participating primary care physician will respond back to that and with what the course of action would be, or a medication that would get ordered for you, and it essentially limit the need for you to go, if you're not feeling well, into a physician's office to have the care. And then we're trying to make it even more patient-centric and keep the patient in control of their medical information.
In 2019, more than 100,000 people downloaded the app, and about 350 medical providers and physicians in the community use MyChart for access to health records.